At GW, we've been using the Surgical Theater 360-degree VR platform. It's been used several years now, both for surgical planning as well as patient education. When we had our COVID-positive patient transferred to us, we very quickly recreated these images into the VR platform so that we can get a better look at the damage that is being caused to the lung. When we recreated the images into 360-degree virtual reality, it became obvious very quickly that there's such a stark contrast between the virus-infected abnormal lung and the more healthy adjacent lung tissue. The damage that we're seeing is not isolated to any one part of the lung. This is severe damage to both lungs diffusely. GW transferred in first COVID-positive patient. This is a gentleman who is in his late 50s, whose only underlying medical condition was high blood pressure. He initially developed a fever and a cough, which, like many others, then progressed to shortness of breath. He had presented to an outside hospital where very quickly he needed to be intubated to have a breathing tube placed in his mouth, into his airway, and connected to a mechanical ventilator. There's rapid progression and damage to the lungs, so that he needed higher and higher levels of support from that ventilator, and it got to the point where he was on maximal support from the ventilator. And that's when the outside hospital reached out to our expert team here at GW, and the patient was transferred to us for something called ECMO, which stands for extracorporeal membrane oxygenation. And that's a fancy way of saying that the blood actually needs to be removed from the body to be oxygenated and then returned to the body simply because the mechanical ventilator by itself is not adequate.